Assalamu alaikum wa rahmatullahi wa barakatuh. Today we will discuss Collection of Evidence lecture by Dr. Ghada Nabil Mahmoud Sarnagawi. Objectives of this lecture. By the end of this lecture, you will be able to define forensic evidence, recognize types of forensic evidence, recognize methods of collecting, storage of samples, stains, and specimen, identify chain of custody, describe the common circumstances where analysis may be requested, and discuss role of the physician in collecting evidences of wound, firearm, sexual assault, and in acute poisoning cases. Firstly, we identify forensic evidence. What is the meaning of forensic evidence? Forensic evidence is evidence that is obtained by application of scientific methods and is susceptible to use in court proceedings. Value of forensic evidence. There are many values of forensic evidence like identify the responsible persons, establish an element of crime, reconstruct crime events or linking crimes, and linking a suspect or victim to a crime, linking victim to a suspect. Therefore, improperly collected and handled physical evidence can weaken or destroy proper evidence in courts of law. Types of forensic evidence. There are two major types of forensic evidence, either physical or biological. Physical evidence like clothes, foreign bodies like bullet, shots, piece of glass inside the wounds. The second type of forensic evidence is biological evidence. Biological evidence anything belonging human like blood, semen, urine, gastric lavage sample, saliva, and hair. Chain of custody. It is an important term to know the story of forensic evidence and means chronological documentation and unbroken transfer of evidence showing collection, transfer, analysis, and disposition of evidence to final of the results. Means Dr. Muhammad, for example, Dr. Muhammad takes the forensic evidence, then he signs this with date and time on the label of evidence. Give this evidence to Mrs. Rida. Mrs. Rida take the evidence and sign her name with date and time. Why the story of forensic evidence should be well known from collection to final disposition as to maintain specimen integrity to be admissible in front of courts. What are the common circumstances where analysis may be requested? The analysis of forensic evidence may be requested in these cases: after suspected drug poisoning, in accident investigation either for identification or for determine whether drug may have a role in this accident or not. In homicidal cases, collection of evidence is mandatory in stab, firearm, rape cases, and after this with possible criminal offenses as assault and murder. Before taking sample from victim, you should take consent from the patients of the victim, then taking sample and make sample collection, then maintain a chain of custody. General consideration of sampling. Before taking the sample, you should read complete instruction for this sample. Second, you should avoid contamination by wearing clean latex or nitrile gloves for collecting items of evidence. Third, use correct container with proper preservative for biological samples. Fourth, collect early and sufficient amount. Ideally, specimen should be collected within 24 hours of the assault. After then, evidence may be fade and shed out from the victim. Therefore, you should collect early within 24 hours of the assault and with a sufficient amount for allowing analysis of this sample. After then, all specimens must be clearly labeled and properly sealed to be identified in court, and the label includes general part and special part. General part about full name of subject, name of person drawing sample, date and time of collection, the type of specimen and its amount, and the special part including chain of custody that includes where the evidence was collected and stored, what was done to the evidence, means analysis, name of all persons handling the evidence, and date and time of this analysis. Other information such as laboratory number, offenses charge, anatomical location from which blood sample was drawn, or special instruction. Then the specimen should be sealed to avoid interruption of this sample. So the label of the evidence include the upper part include the general information of the evidence as the name of the victim, name of the physician that draws the sample, location where collected, and type of offenses, and the lower part of label include data about chain of custody as received from this evidence received from, for example, Dr. Muhammad, and he signed his name, and everything should be collected, should be documented by date and time. The physician should document by date and time every event. Therefore, I will know all process of the evidence since collection up till final disposition in front of court. After then, you should know precautions for biological stain collection. Stains may be wet stains or dry stains. For wet stains, if the skin appears moist, the stain should be retrieved on dry cotton swab. Then it should be allowed to dry prior to pack in paper envelope. So, the steps for retrieved wet stains are firstly retrieved by dry cotton swab, secondly allowed to dry, thirdly packing in paper envelope. The second type of stains are dry stains. All dry stains should be retrieved by moistened swab with distilled water, not by saline. Why I use distilled water, no saline? Because saline contains sodium chloride crystal that can be present in the field of analysis and confound the results. So, the dry stain should be retrieved by moist swab with distilled water, not saline. Then it should be left to dry and pack in proper paper envelope. Store all dry swabs at room temperature until samples are transported. Now, there are two questions of the previous section. First question, give reason or why packing the wet clothes of victims in paper bag, not in plastic bag. The answer, because plastic bag retain moisture which hasten degradation of organic material. We need to make analysis of organic material like DNA. So if we put the wet clothes in plastic bag, the plastic bag retain the moisture in the clothes that lead to fast the degradation of organic material like DNA. The second question, moist swab with distilled water is preferred than saline for collecting the dry stains because saline can crystallize and confound the findings of the result. Finally, regarding general consideration of other biological samples, evidence that cannot be dried as piece of tissue, bone, fetal material, should be collected and packed separately in airtight, sealed, label container and preserved in 10% formalin or formaldehyde. Now we start to discuss the sample and evidence should be collected in common circumstances where analysis may be requested. Firstly, what are the samples should be collected in wound case? For example, in stab wound cases. Samples should be collected in wound cases. Clothes. Examine the patient clothes and document any obvious stain or tears. If cutting is required, this should be done away from any stains or tears to avoid evidence interruption. All wet clothes should be allowed to air dry and each item should be folded and placed in a separate paper bag and sealed and labeled. The victim should be asked to undress over a large sheet of paper to collect any loose material, then folded in itself and sent to the laboratory. Second, examine the wound. Careful documentation of any open or closed wound by using the correct descriptive terms as in primary medical legal report. If you found a bite mark, it should be documented, measured, and swabbed for saliva. And saliva is a stain, may be wet or dry. If the saliva is wet, should be retrieved by dry cotton swab, and if it's dry, should be retrieved by moist swab with distilled water. Third item, weapons. Don't forget to search for component of the instrument in the wound piece and package it carefully in labeled appropriate container. We prefer paper or cardboard container if we search on organic material. Blood sample. Blood sample should be taken in purple top blood tube. Purple top blood tube contain EDTA preservative, as EDTA prevent hemolysis of the blood. This sample considered as control DNA sample, as foreign DNA may be presented in the victim. Nail clipping or fingernail scraping for DNA analysis, and this DNA may be compared with other DNA of the suspect. Second case is a firearm. What are the samples should be collected in firearm cases? As we discuss in wound case, clothes of victim worn at the time of the assault should be preserved for any missiles, trace evidence, and gunshot residue. Clothes shouldn't be cut through the starting of bullet hole for purpose of removing clothes to avoid interruption of evidence. Second, we take blood sample in purple top blood tube as it's useful for DNA testing of the victim, as may I found different DNA on the victim, so it is maybe belong the assailant. Third, we make handling of firearm evidence. Wound region should be X-rayed prior to removal to detect its site. Firearm evidence should be collected by using rubber-tipped forceps or a gloved hand, not metal forceps, as metal forceps cause distortion of primary and secondary rifling marks. These rifling marks are very important for test comparison between extracted bullet and experimental fired bullet. After extraction of the bullet, it should be wrapped with cotton gauze, then secured in label paper envelope. If the bullet is bloody, should be dried prior to pack by tissue paper. Again, don't handle projectile with metal instrument because forceps and clamp can distort rifling mark in lead projectile and metal jackets. Don't mark bullet to avoid distortion of rifling marks. Swab for gunshot residue. It should be swabbed around the wound with two widely used methods. Include a carbon-coated adhesive stop or with alcohol swab. To be prepared for scan electron microscope. Carbon-coated adhesive stop has a black electrically conducted adhesive layer protected with cover. It can collect elements like lead, barium, antimony, copper, strontium, and mercury that may be present around the inlet. Then, scan electron microscope can analyze this elemental composition present in carbon-coated adhesive stop and compare with elemental composition of suspected weapon. Alcohol swab can collect the greasy material containing elements around the inlet and then prepared for scan electron microscope also. The third case is a sexual assault case. What are the samples and evidence should be collected in sexual assault case? Firstly, as wound and firearm, clothes of the victim, 4 blood samples, urine sample, genitoanal swab, pubic hair, fingernail, oral swab, and any additional swabs including saliva from bite marks. Firstly, clothes of the victim. Clothes. Each garment should be properly labeled and placed separately in paper bag after drying. Collect the underpants that are worn at the time of examination even if they were not worn at the time of the assault. If the victim changed her clothes, you still can take the underpants even the external clothes is new clothes without tears or stains. Clothes are tested for biological stains such as blood, semen, saliva, and trace evidence from the assailant. Blood samples. You should take 4 blood samples. As wound and firearm, first blood sample is in purple top tube that contain EDTA is useful for DNA analysis as control sample for the victim. Toxicological test is indicating if the patient's complained unconsciousness, lack of motor control, amnesia, or confusion. Blood sample at least you take 5 ml should be collected for alcohol or drug analysis in gray top blood tube that contains sodium chloride preservative and potassium oxalate as anticoagulant. Last 2 blood sample for sexual transmitted diseases, syphilis, hepatitis should be repeated in case of negative result, and blood sample for pregnancy test also should be repeated if the result is negative. Third evidence is genitoanal evidence. You take plain cotton swabs, not those contain media or other media, should be used by touching from 4 sides. Firstly, we start by the rectum or the anus. You take swab from the inferior of the anus or rectal swab. It must be taken before vaginal swab to prevent the fluid of the vagina from dripping down to contaminate anus. Then you take vaginal swabs. We divide the vagina up to 3 parts: lower part, middle part, and upper part of the vagina. You take firstly from lower part, the interior of the vulva, labia, and around the vaginal orifice. Second, you take from mid-vagina by using speculum. Third, you take from upper vagina and cervix. 2 sets of swabbing are obtained from each region. From each 4 region, anus, lower vagina, mid-vagina, high vagina, we take 2 sets. The first set of swab from each region is rolled across clean glass slide to obtain thin smear for examination of spermatozoa instantaneously, and the second one left to dry prior to envelope in paper bag or paper envelope. These for identification of semen of the assailant, about grouping, and DNA analysis. If any fluid running from vagina, vulva, anus should be collected by clean pipette and preserved in the small tubes to prevent evaporation. Keep in mind that spermatozoa can be identified only for 48 hours after assault. All appropriate evidence, including clothes, swabs, and slides, must be air-dried prior to packing. Fourth, pubic hair. Pubic hair may be matted by secretion, so matted hair should be cut off and preserved in paper bag after drying. Or pubic hair may be presented as loose hair. Any loose hair may be belong victim or maybe belong assailant. So loose hair should be combing to collect foreign free hair, then place in paper envelope. After taking hair sample, you should take a standard control sample of 10 to 20. Either scalp hair or pubic hair may be pulled by forceps, not cutting by scissor, as pulled hair contains root. The root of the hair contains a nucleus that enable for DNA analysis. Fingernail clipping or fingernail scraping at the epithelial cell or blood cell may be present under nail is belong to assailant. Nail scraping is done by strile to spike. Both are collected separately for right hand and left hand in plain paper, then folded and put in paper envelope. If the nails are too short to cut, try using a swab with few drops of sterile water to collect evidence along the nail edge. 6. We take oral swab. There are two oral swabs, either buccal swabs for DNA analysis of the victim from inner sides of the cheek as control sample, as buccal mucosa contains nucleus that enable for making DNA analysis. Oral swab. The second oral swab, if there is an allegation of ejaculation into the mouth oral sex, you should take a swab within 12 hours, not for 48 hours as vagina. Why? Because semen is rapidly lost from the mouth by dilution with saliva, swallowing, eating, and drinking. You should collect as genitoanal swabs 2 swabs from inner surface of lower gum lines around teeth surface for semen analysis, as semen is fluid down by gravity into dependent area of the mouth. So the best site for oral swabs is lower gum line and around lower teeth surface. You should take additional swabs from any alleged bite mark, any stains, dried semen present on the victim, but you should take control swab. Again, patient reference sample included pulled scalp hair, pulled pubic hair, DNA sample from blood sample on purple top blood tube, buccal swab from inner side of mucosa, control swab collected from unstained area adjacent to the skin to interpret of the result. Finally, what are the samples to be collected in an acute poisoning cases? The following should be collected, packaged in a separate container, sealed and labeled. Firstly, blood sample. Second, urine sample. Third, gastric content sample in case of toxic ingestion, and any accompanying suspected chemical or physical evidences like drug tablet, bottles, and syringe. Firstly, we take blood sample. The specimen of a choice for quantifying and interpreting concentration of drugs and their metabolites is blood. At a minimum, 10 to 15 milli sample should be collected in gray top tube before administration of any medication. As a general rule, most laboratories will not detect a drug in blood if the blood is collected more than 24 hours after the last ingestion. The second sample is urine sample. The best specimen for comprehensive drug screening. Drugs in urine sample can be detectable for days, and concentrations can be many times higher than those associated blood sample. Therefore, Urine sample are the better choice than blood sample for investigation seeking to answer question drug use or exposure. It can be used for detection of substance abuse like cocaine, tramadol, amphetamine, and so on. We take 30 milli sample of urine in plastic container without any preservative to retain any liquid that might leak. Again, blood level are quantitative as it gives level, whereas urine levels are qualitative, give positive or negative as screening. Finally, gastric lavage sample. We take 10 to 15 milli of gastric fluid is the first aspirate of gastric content by using nasogastric tube collected in an empty label vial without adding any preservative and kept at minus 20 centigrade. These are resources and references of lecture for further reading. Thank you for good listening. I hope now that the lecture become easy, interesting and clear, and goodbye.